The information of blood group type is important during transfusion because if mismatched, it may lead to death. A blood group is based on presence and absence of antigens over red blood cell surface. More than 345 different types of antigens have been found so far, and these antigens give rise to 38 different blood group systems and several hundreds of blood groups in humans. Chemically, these antigens may be proteins, carbohydrates, glycoproteins, or glycolipids, depending on the blood group system. Here is the list of 38 different blood group systems: ABO, RH, P, MNS, Lutheran, Cal, Lewis, Duffy, Kidd, Diego, YT, XG, Skiana, Dombrock, Colton, Landsteiner, Wiener, Chido, HH, XK, Garbage, Cromer, Knobs, Indian, OK, RAF, JMH, Lee, Globoside, Gill, RH associated glycoprotein, Forsman, Langeris, Junior, Well, CD59, Augustine, Cano, and SID. But the two most important blood group systems are ABO and RH. In ABO system, there are two types of antigens, antigen A and antigen B. So depending upon the presence and absence of these antigens, there are four types of blood group. The blood in which A antigen is present over red blood cell surface is called A blood group. The blood in which B antigen is present is called B blood group. The blood in which both A and B antigens are present are called AB blood group, and the blood in which neither A nor B antigens are present are called O blood group. Antibody A and antibody B are produced by the immune system in the first year of life by the sensitization of food, bacteria, and viruses. These antibodies are IgM and circulate in the blood plasma. The corresponding antigen and antibody reacts to form a clot. For example, antigen A and antibody A reacts to form a clot. That's why the antigens which are present in red blood cell, the corresponding antibody of that is not produced by the immune system to avoid the clotting of blood. And due to this, blood group A have only antibody B, blood group B have only antibody A, blood group AB have neither A nor B antibody, and blood group O have both A and B antibody in the blood plasma. RH is the second most important blood group system after ABO. The RH blood group system consists of 49 different antigens, out of which 5 are important, and they are represented as capital D, capital C, capital E, and small e. Among these 5 antigens, D antigen is most important. The term Rh factor, Rh positive, Rh negative refers to the Rhd antigen only. The presence and absence of Rhd antigen make blood Rh positive and Rh negative, respectively. Together, ABO blood group system antigens and Rhd antigens give rise to 8 different blood groups. During transfusion of blood, the compatibility is checked by considering donor's antigen and recipient's antibody. Here is the table showing blood type compatibility. By observing the table, it is clear that O negative is the universal donor and AB positive is universal recipient. These 8 blood groups are only considering the antigens of ABO and RH blood group system, but there are other several hundreds of antigens present over red blood cell surface. If mismatched during transfusion, it can lead to serious consequences. That's why a defined blood group of a person should contain a complete list of about presence and absence of all the known antigens, and it should be matched with the similar list of recipient blood type to avoid any consequences during blood transfusion. But in practice, during blood transfusion, only the most important ABO and RH blood group system is considered for testing, which confirms one out of the 8 blood groups. There are three main reasons for considering these two blood group system. First reason is A or B antibodies are easily found in the blood plasma of any person. That's why If not, check the blood for ABO system antigens and transfused to the patient, there would be more than 90% chances for serious consequences. Second reason, Rh antigens are not predominantly present in the population, and if not checked for Rh antigen and by mistakenly Rh positive blood transfused to the Rh negative person, then sensitization would occur, and later subsequent transfusion of the same Rh positive blood can lead to death. Third reason, the antigens of other blood group system apart from ABO and Rh is predominantly present in the population, more than 99%. So less than 1% person is under risk, and this risk is also eliminated by simply mixing the blood of donor and recipient and observing for the presence of clot. The formation of clot indicates mismatch, and clear blood indicates that the blood is okay for transfusion.
Please like and share my YouTube channel. And if you like to watch more videos like this, so please subscribe.